Optic disc collateral vessels. What's the cause? In this patient, the cause is a previous central retinal vein occlusion, and so disc collaterals, or also known as optociliary shunt vessels, are dilated venous channels seen near the optic disc, and they develop as a secondary response to chronic central retinal vein occlusion. And so in CRVO, central retinal vein occlusion, the central retinal vein obviously becomes obstructed, most often near the level of the lamina cribrosa, and this leads to a backlog of venous pressure, congestion, and impaired outflow of blood from the retinal circulation. And so to bypass the blockage, the eye may develop these collateral venous channels that connect the high pressure central retinal circulation with the lower pressure choroidal or ciliary venous systems. And so these alternative pathways help divert blood around the obstruction, reducing the venous stasis. And disc collaterals may typically appear weeks to months after the initial occlusion, once the eye's had time to remodel its microvasculature. And so we see these here as these tortuous, engorged vessels on the optic disc without any accompanying hemorrhage or exudation, which is exactly what we're seeing right now. And so they're best appreciated on fluorescein angiography, but we can also see them on slit lamp examination. And their presence indicates this chronic or resolved CRVO rather than the acute event, and they do not signify neovascularization. You need to make that distinction. And unlike the neovascular vessels, they're mature, they're stable, and they do not leak. And then you can tell that on FFA. So clinically, they offer prognostic information. Their development suggests this degree of adaptation, which means a lower risk of ischemic complications such as neovascular glaucoma. Hope you found this video useful, and make sure you monitor them and have a look at them clinically if you see a patient like this.